Welcome to another episode of Ask Your Doctors. I am Dr. K. Welcome. In this week's episode, the regular content features line up as usual. We go viral with Dr. Bundolo Mashishi, and we take you to our directory where we find your doctors. So today we are still fortunate to be having our friend of the show and acclaimed gynecologist and sexologist, aka Dr. Gynae. How are you, Dr. Zenda?
I'm well, thanks, Dr. K. How are you today?
Welcome back.
Thank you.
Thank you for making the time again. You know, people that have connections, they say they can pose their own questions. So our crew, they get naughty. When we have production meetings, they come with their own stories. They claim it comes from the audience, but I know it comes from them.
Right.
One relevant question, which is for the benefit, as a follow-up, for the benefit of the audience, as a follow-up from last week's show. They say it's been asked again on our social media pages.
Right.
How many times does one have to have oral sex for them to develop throat cancer? Guys want to count and then say, okay, now I stop. Or throat cancer, sorry.
Right.
Yeah.
I think it's a very difficult question because it also depends on who you are having that intercourse with. If you're having it with one partners, so things that will increase your chances are, multiple partners, is unsafe practices during intercourse rather than how many times.
Remember also, guys, we said newly acquainted partners, when you want to do a responsible thing, you don't only have to test for HIV, you can test for a whole lot of other STIs and related viral incidences that may be there.
Absolutely.
Now, I believe that answers that. And it's like saying, how many times must I sleep with someone for them to fall pregnant?
Absolutely.
This crew is naughty.
They are people too with sexual lives.
They're sitting there asking themselves.
They must get benefit for being part of the show.
In any case, another question, disguised as part of the audience questions, says fertility and the cycle,
right?
The reproductive and the monthly cycle,
right?
How do we maneuver? They say,
right?
Is a lady the most fertile before, during, or after the cycle?
Right. So the lady is most fertile at around day 15 of the cycle. And where do you start counting? First day of their period is day 1. So if you count up to day 15, that's around the time. But give or take, there might be 2 or 3 days on either side of that day 15, right? The other important thing is some people have really short cycles, or they have longer bleeding time. So if someone bleeds for 7 days and you're not the cross the Red Sea kind of guy, you've got more limited time to then, if you're not trying to fall pregnant, to have that so-called safe period. That said, please do not be delusioned to think that just because you've had sex during a period, you can't fall pregnant. It is still possible. So if you are intending on not falling pregnant, use proper birth control or contraceptives.
3 things, Doc. People have fallen pregnant without penetration.
Yes.
So today's show is about reproductive health.
Right.
It's not just the fun one that we had last week.
Yes.
And that's number 1.
Right.
Number 2 is that you taught us about the responsibility that you assume when you start assuming fewer partners and you start using condoms.
Right.
Number 3, this crew is naughty. They were here when you spoke about condoms. And the only thing going in their head was the cycle, and I got lost when you said 15 days and day 1, and I said,
right.
Right. So I think, let's keep it. No more questions from the crew.
We like the crew.
What are the most common reproductive concerns between males and females?
Right.
Just generally.
Just generally,
overview.
yeah. A lot of women, I would say, they often wonder about, can I fall pregnant? Can I have children? And sometimes because we often don't know the background of our predecessors, you know, family history and that kind of stuff, or people don't know when things are going wrong. Someone who's got maybe fibroids, you find that it's been in the family, but they didn't know. Time comes for them to start having children, they find they have issues. Endometriosis is another one. So a lot of the time women worry about the clock and whether or not they will be able to have children. Men, funny enough, are often concerned about, can I perform in bed? Can I perform?
Because we don't really want too many babies. We want ongoing performance.
I'm just saying, you know, it's
it's
interesting how a woman can only fall pregnant once in 9 months, and a man can impregnate a whole nation in 9 months.
Yeah, shame. Yeah, privilege, eh? It's privilege.
Too much privilege.
Men will forever be privileged. And fertility, I know of situations where our society hasn't accepted that men can be involved in infertility issues. And this is serious now.
Very, very much.
Because this is educational.
Right.
Guys, we can be part of the problem. That we do not possess what it takes for us to make a life. So please do not burden your woman by saying it's your problem. You've been cursed, you know, stuff like that. Right. So let's talk about it. Right. Men and women.
Right.
Briefly, how does it affect us?
That is such a huge concern. And I often say to couples, always think of fertility, it's our thing. You know, it's our responsibility. Even when there's absolutely nothing wrong, we're trying to fall pregnant. If exercise is good for me as a woman, it's good for you. If taking folic acid is good for me, it's good for your sperm as well. If decreasing alcohol is good for me, it's good for you. So it is our thing. When we go to a gynae, please go and see the gynae together and express what the concerns are. We know that actually 50% of fertility issues are male related, whether it is sperm or on. I think
and
maybe
it's not a curse.
No, it's not a curse at all. I think the information and the education should allow us to be able to have information so we can access. I mean, the technology is incredible this day and age. So when people are informed, and I'll say, I'll go to the gynae, you go to the urologist, or you go to a fertility place where we can analyze your sperm and see, is everything okay? If everything is okay, fine, let's do the basic things first, because there are a lot of factors that may impact a couple's ability to have children.
And both times you hold hands.
Absolutely.
Because there's nothing secret about what I'm doing there and what you're doing there.
And even being more open about other options. You know, you don't have to carry a child in your own womb, or for the child to have your own bloodline for you to be able to raise and contribute positively in someone's life. There is adoption that is still an area that we are very reluctant in. And yes, for sure, there's always socio-cultural issues, belief issues that we kind of bring into place. But I always say, raising a child is raising a child. Yeah.
You probably do a lot of counseling for couples.
Yeah.
Any idea any inputs on how we can eradicate stigma regarding infertility?
I think men have to get involved, and it's not just infertility, it's contraception, it's pleasure. We need the men to be more involved in the conversations, and positively so. And I say that because I strongly believe that there is a really great mantle of leadership that you carry as a man in your own house. And so if you have a tenderness about the conversations you are having, if you have an openness, if you have a proactiveness about, baby, let's get things sorted. I am with you, I am supportive of you. A supported woman goes a mighty long way.
So does a supported man.
Absolutely.
Yeah. Dr. Minga now and then says when women sit in a corner
Yeah,
they're
right.
cooking, they're doing whatever. Men are doing the braai outside.
Right.
The women are probably saying, Chomi, when this happens, try this, try that. My friend from elsewhere tried this, and I've had this, I read this in a magazine, I read this online, whatever.
Right.
The men outside are busy saying, me, I hit 5 rounds, you know, and they're all lying.
Yes.
And me, my car, the engine. Right? So there's no way men can get around advising each other about useful health things.
Right.
Because all we are about is machismo and lies, and you know, it's wrong, guys. Let's talk about prostate. Let's talk about immune boosters. Let's talk about gym. Let's talk about does gym improve chances of fertility? Either way,
100%. Both sides. A woman who is, for example, and this is where us girls can be quite sensitive. Weight, high BMI does slow down body mass index. Okay. It does slow down your ability to conceive, and our fertility specialists will tell us that literally just by dropping even just a little bit of your weight, just by 10%, you already improve your chances of conception. But also with men, 100%, and you need the libido to be able to.
We are back there.
To do the. You said today we are serious, Dokotela. Right? So okay. It's important.
Sorry, Doc. What we say is a bit of weight loss improves self-esteem and physiologically improves libido. Yeah.
And improves sperm count and improves and the quality of your eggs as a woman.
Okay, maybe I should stop gym. I don't want any more kids.
It's for the libido.
Yeah, I'll take your other advice. Reproductive health rights for both men and women. What can you say?
Every single one of us has a right to practice and express their sexual behavior, their sexual needs, but also their sexual aspirations. And when we talk about reproductive in particular, I think we can go, the spectrum is huge, from sexual violation, that is a violation of someone's rights. But even things like, if I say, baby, I want a kid, and you say, I don't. If I go ahead and stop contraception, it's actually a violation of your reproductive rights if I have manipulated things to get what I want and infringe on your reproductive right. And I think that's something girls can go to ladies' camp for. It's important that every single person's reproductive rights are important. Then you get things like access to reproductive health, being treated well, being given the information as you get or as you're being informed about your reproductive rights, not be stigmatized or and I'm thinking along the lines of my minority communities, the gender-based, not gender-based, the LGBTIQ communities. They get a lot of violation as they try to express their sexual rights. People we forget about a lot are elderly, right? We think sex is only for the young and fit and healthy. No, those people also have the right to sexual and reproductive rights. We think about the disabled, for example. We often are very dismissive and in the way that we service people. So all those things come to play, and we, particularly as clinicians, we always have to be cognizant how we address people. Ask a person, do you want to be addressed as a he, a she, a they, a them? It is their right. As long as it's not infringing on anyone else's, we ought to be mindful of everybody's rights.
It's important you mention all the communities that we should take cognizance of. And just by the way, as a group, we subscribe to all rights for living beings, plants, animals, human beings, and the likes. And when we mention rights, it's not only political or legal, it's also human.
Human right, yes.
Do you afford your fellow person the same rights you would like to be afforded? Forget government.
Absolutely.
Yeah, because that's where it begins, because we are the ones who violate each other.
Oh, yeah.
Yeah, but the part where you say, the ladies mustn't take over the rights totally of having babies. I think my Facebook friends are probably going, it's good for the sound bite. And guys out there, remember all these questions, except for the naughty two at the beginning, come from social media. So please do go to our social media pages, Facebook, Instagram, Twitter, TikTok. I don't know if we have WhatsApp, but anyway, just go to our website, get the links and start asking away, because we will get all the experts that you're looking for. And we will play your questions as we are playing them now. Alrighty, Doc. You already told us how to safeguard people's rights.
Right.
And reproductive health, you think we're doing enough in communities? I was going to say, when we're talking about rights and rights being honored at all levels, there's a Sister Mufukeng in my hometown clinic. I'm whatever age. First, I'll make sure I take off my school uniform just to, minimize the stigma and discrimination. I get there, she says, yeah, but that condom, go home. And girls go through the same.
Right.
And there's the termination of pregnancy.
Yes.
And your starting point is the clinic.
Right.
But many people don't get much joy in the clinics. So do you think in communities we are clued up? And I know there's still a lot of work to be done.
Yeah.
What do you think should be happening?
I think we're not doing enough. And I think to be fair, we often put a lot of emphasis on the nurses or on the teachers. I think let's start in our families. If we are not having age-appropriate, open, honest conversation, if my child comes and says, Mama, whatever, Mama, what is sex? And I'm like, hey, don't ask that thing. I have violated or I have infringed on her right to have information, but also I'm setting her up for failure, because believe you me, someone out there is going to try or attempt to educate her, and it might be inaccurate or substandard information. In the family, in the household, we have the greatest influence on our children, and it is a myth. It is It is not true that educating our children about their bodies, about all these things, contraception, sex, is going to basically encourage them to go and be promiscuous and be sexually active. That's not true. Giving them information gives them the tools to make appropriate and right decisions for themselves. So by the time they're getting to Sister Mufukeng, it's probably the attitude that Sister Mufukeng has in her own household and has taken that into her workspace.
Believe me, it belongs to the local clinics. It's very consistent.
And it's not okay. So we need to also be able, I often say, when we're talking about things like vaccinating the young children or the young girls, we have to go through consent. And that means we must speak to the parents. So if we are educating the community, it can't just be, oh yes, the rights of the children. Children live within the community or within the families. So educate the parents as well. They may have grown up in an era where this was not a conversation to be had. So you treat both the adult and the child so that it is a conducive environment for the information to seep in.
How do we educate the parents? It's very easy to say it, easier said than done.
Yeah. You have to appeal to, remember, the parent has the best interest for the child, but they don't necessarily have all the information. So we need to create platforms where parents can ask the relevant questions. Remember as well, a lot of the parents didn't know how to ask these questions for themselves too. So very often they are doing this out of their own fears, out of their own experiences, and out of their own lack of information. You have to appeal from a perspective of, I care about what you think. I care about your own traumas as you were growing up. Let's address that and not pass them down to our children.
Seriously speaking, platforms like this one.
100%. Yeah.
When we go to YouTube, we see our children spend 6 hours on YouTube, which is not right.
Yeah.
And we should be making sure that they're using social media for the right reasons,
right
the
reasons.
Wi-Fi in the house for the right reasons,
Yeah.
but the Wi-Fi is not limited to our kids. When we switch on the TV and you want alternative stuff, very soon we will be having our own TV show here, there, wherever.
Yeah.
And this is content that should be permeating our airwaves.
100%.
Yeah.
100%.
Reproductive checkups and interventions.
Right.
Practically speaking, parents of children that are of what do you call it, puberty
You're right.
age,
Right.
saying, I'm wondering if I should put a device in my daughter
Right.
already, or whatever. What's your opinion on that? I'll talk about the boys. And I know
Yes.
we all do this until they finish university or something. I'm raising a 14-year-old daughter alone.
Yeah.
So to speak. We live alone now. My son is
Right.
at university.
Right.
So she can barely tell me about what happened at school.
Right.
I ask her many times, but I usually switch off the Wi-Fi and then she comes screaming and then we start talking.
Yeah.
You know, so children,
Right.
youth, puberty, interventions, checkups,
Right.
both genders and many other people in communities, but puberty.
Yeah.
What's your suggestion?
I'm so glad you talk about puberty for both girls and for the boys. I think one of the biggest error is that we often want to educate the girls, but who do they end up dating for the majority? It's the boys. So if we are not normalizing the conversations for both boys and girls. Now, for me, it actually starts even before puberty. I say start creating the environment of this is a conversation. As a parent, you are the safe space for them, as a community even, because you'll find some child-headed households, but if you go to Malume next door, Malume must not be the abusive one now. They must be the father figure within that space. And then when we start by having the right conversations, just be interested in your children's life. But secondly, as they go into puberty, answer the questions. Children are very good at asking you questions. Don't use euphemism. It's okay if you don't know. Hey, I don't know. I've never thought about that. Mama, how do we fall pregnant? How does a person fall pregnant? Don't use euphemism. Even things like the language of kikuku, kiflower. Use the correct languaging and don't put any frills around it so that children learn to communicate at a young age. Then we get to our bodies change. You know, I mean, from even my own experience, people start treating you very differently when you start having, you know, breasts and you start having curves. You will walk down the street and you know the boys are suddenly whistling at you and you're like, what's wrong? Remember, they're still children. Their body is physiologically changing, but they still think like children. It's also at a time very often the preteen, teen years where they are aware of things like self-esteem and so on. Teach them about those things. Why is your body changing? If you don't have the information, take them to somebody, a clinician who can. That allows you a platform where you have been having the conversation. By the time you want to talk about what do you think about contraception? Contraception is this and this, my child. And if you do start thinking about being sexually active, you would have given them so much more before that one conversation. And you. From an ethical perspective, as a parent, you can't force. You can have the conversation and find out if a child is willing for that. But also, I think that the flip side is true, where you often will find that contraception is not only, particularly for the girls, is not only for prevention of pregnancy, but you'll find a girl who may be having very severe, painful periods, who's having an irregular period, who is having a heavy period that is impacting on her quality of life, particularly being able to go to school.
So it doesn't mean you're encouraging sex on a
you
teenager.
could actually be sorting out something else. So if you are not sure as a parent, ask, take your child to somebody who may know and be willing to be educated as well.
Okay. There's a story I have about my boy, but because that would answer the part where but the one important thing about boys is we need to stop making boys feel like it is okay to violate girls.
Yeah.
And whether for reproduction or we need to stop putting pressure on boys to become extenders of our clan.
Yeah, I know.
And we need to, because I put pressure on myself, and I knew that I needed to have a lot of boys so that I could extend my clan, because I'm the only boy in my house,
Right.
5 sisters and whatever. But we need to know that it's okay.
Yeah.
Whether you have children or not,
Or
it is
not.
fine.
Yeah.
It is entirely
It
within
doesn't
your-
make you a man or less of a man
Yeah.
if you don't, yeah.
We would like to go viral now and find out from our virologist, Dr. Bunolo Mashishi, if she can give us any insights on COVID. Over to you, Bunolo.
So whether or not we're going to be seeing the end to COVID-19 is a question that has been making rounds for several months now. What we do know is COVID is going to be around with us for many, many years. How it's going to live with us and how we're going to live with the virus is a separate question altogether. What people think is an end to COVID virus is really quite dangerous because it may encourage people to relax, not wear masks, keep a safe distance, and that could be taking us a little bit back and making all the efforts that we've achieved null and void. So yes, the virus has changed. We're seeing people not ending up in hospital as we previously used to, but certainly this does not mean that it's over. COVID is still a pandemic, the virus is still with us, and we have to learn how to live best with the virus.
Right.
Lifestyle, how does it affect?
Right. So endometriosis is an inflammatory process. It's an inflammatory process. So anything that raises your inflammatory markers. So in terms of food, alcohol, caffeine, sugar it exacerbates that inflammatory process.
And target group, who should watch out?
I think any woman of reproductive age, particularly if they are being bugged by period pains quite significantly, the earlier the better.
Thank you, Dr. Mashishi. Guys, welcome back. We are still hanging out with the lovely Dr. Zenda, aka Dr. Gynae. Doc, let's get right to it. IVF. Give us a rundown of what is IVF.
Right, so IVF is actually just one of the processes or the procedures that fall under.
Let me behave.
Yes.
In vitro fertilization. Yes, I mustn't talk as if everyone knows what we're talking about.
Yes. So it is just one of the ways of what we call it's part of assisted reproduction. So wherever a couple, for whatever reason, is unable to fall pregnant in the natural way, it is then the taking of the sperm and the egg, infusing them together. Instead of the natural way, which is inside the tube, it is done outside and then we put inside the embryo.
And the incorrect word used to be test tube babies.
Very
back then.
incorrect.
Yeah, I know, yeah. And that gave a stigma to the thing.
Yeah.
Because it was as if we were not doing the right thing.
Right.
Yeah, no, thanks. And how accessible is it to our communities? And what, I nearly said indication. Who likely uses it, IVF?
Right, so any couple actually that is struggling to fall pregnant, generally from the gynae side of things, we would look at a couple that has been trying to have a child with the right amount of sexual intercourse, all things being well, for more than a year, if they are less than 35 years of age, particularly the lady. If they're more than 35 years of age, we give them 6 months before we send them to a fertility specialist who will then do further testing to see what really is the issue and then go ahead and implement if they're able to. In terms of access, it is still a very contentious issue because you'll often think to yourself, having children should be a right accessible to everybody, whatever the situation is. But we do know that particularly for public health, we're still a long way away from everybody being able to access those kind of facilities. I know at the moment in Johannesburg, or rather Gauteng, Pretoria, Steve Biko, they do have a form of being able to subsidize assisted reproduction. But even then, there's still a fee. What happens to somebody who doesn't have that amount? So the access is not
as good as
truly
it could be
accessible to everybody. Even people who kind of earn and have medical aid and stuff, it is quite an expensive process that is not necessarily 100% guarantee that, you know, on your first IVF trial, it will be successful.
The human side of it, any beautiful stories you recall?
Quite a few.
Nice.
I know, you know, we often think couples there needs to be something completely wrong. You get, for example, I currently have couples who are same-sex couples who wanted to have children, and that process has allowed them to be able to have children. They have beautiful children like you and I. So couples who, for example, had, big fibroids and therefore couldn't, and they go through the process of having miscarriages. We discover they've got fibroids, we go and we remove the fibroids, then they go through the IVF process, and it's a circle. They come back now pregnant, and we look after the pregnancy. So there are a lot of people who struggle, and I think it is unfair of us as a community, one, not to be educated, but two, to throw stones without knowing what happens in people's lives and how these things affect them.
You speak of fibroids. Earlier you spoke of endometriosis. These are some of the complications that can affect reproductive health.
Right.
And luckily, you promised you will be back next week, and we will discuss endometriosis, among others. A lot of ladies would know what this is, so we will educate both young and old, ladies and gentlemen.
Yes.
And once again, Doc, where can we find you? I know you are also on our directory, on our website. We go to the website, you click find the doctor, you will find Dr. Zenda, as well as many other experts that have been on our show. Where do we find you?
So for consultations, I am based at Morningside Medical Clinic. You can find me there. We do extend our information sharing to our social media pages, which is dr.gynae. That is our Instagram as well as our Facebook page.
Thank you, Doc. Once again, thank you for making the time. And guys, remember, while you're on YouTube, remember to click subscribe. Thank you very much. See you next time.